Good day, everyone. It is an absolute pleasure for me to be here with you today and to discuss about our personal health. My name is Nasima, and I am an alumni from the Xi-Pi chapter. Currently, I am a senior research specialist at University of Illinois Cancer Center. Most of my current work focuses in community health and health equity, finding innovative methods to address social determinants of health in underserved communities for access to care. I have no conflict of interest to disclose. Today, my talk will focus on preventive care, how to better our health and our loved ones' health. So diving right into it, if I was to ask you, which one of the fire in the picture is easy to control? A, the match on fire, or B, the house on fire? Which fire would require less resources to control or eliminate it? And finally, which fire is causing the least amount of damage? I hope your answer to all the three questions were picture A, match on fire. The match on fire would require the least amount of resources to control it and can easily be eliminated without causing much damage. When it comes to our health, we should be at picture A when we go to the doctors, not at picture B. Actually, the ideal picture would be to have no flames at all. When we go to doctors before we feel sick, it is easier for the doctor to address any problems that may be coming up and take care of it. It is cheaper, faster, and easier to address the issue before it becomes a bigger concern. Too often, we are going to see doctors when it is a little too late. We are getting diagnosed with diabetes, hypertension, cholesterol, late-stage cancer, and many other diseases which can be prevented through preventive care. Preventive care is screening and tests that are designed to help you avoid diseases or illness. Some example of preventive care is annual checkup. This is where your hypertension exam, diabetes, and cholesterol check is being done and monitored. Cancer screening, early detection of cancer saves life, and there are some cancers that can be prevented through screening, such as the colorectal cancer. Through a colonoscopy, any development of abnormal cells or polyps can be identified and removed before it becomes cancer. Often, we do not look at dental care as a preventive care. However, dental care is essential preventive care. One of the importance of dental care, other than getting beautiful smile, clean teeth, and gum, is your oral cancer screening. Dentist examines you during your visit for oral cancer. And finally, vaccination. Vaccines can prevent many diseases, such as the HPV vaccine, which can prevent cervical, penile, and also many other oral cancer. The HPV vaccine is recommended for boys and girls from age 11 to 12. However, vaccine can be taken between age 9 up to 26. Recently, the CDC changed guidelines to increase the vaccine age to up to 45 years old. If you are 27 to 45 years old, you can talk to your doctor to discuss about getting the HPV vaccine. While preventive care is important, getting access to it correctly is also important. The best way to get access is through your primary care physician. It is essential to get care through a primary care physician so you can establish a long-term relationship with your medical care provider. The provider knows your body, your health history, and your health conditions and are able to direct care accordingly. They ensure that you are getting routine screening and immunizations. And when you need to see a specialist, they ensure that they can link you to those specialists and follow up with them accordingly. I always tell individuals, don't go to doctor just for getting bad news. Don't just go there and find out you are sick or unwell. Go to doctors for good news, for finding out that you are maintaining your health and your well-being, and you are doing a great job at it. So how do we access our preventive care and primary care in a cost-effective way? If you have insurance through your employer, spouse, or private insurance, it covers your preventive care visit. So if you're paying for insurance, might as well use it and get your care. Public insurance and marketplace insurance also covers preventive care. Again, if you're paying for it, might as well use it and get care. For those that do not have insurance, there are many nonprofit and federally qualified health centers that will see individuals through a sliding fee, providing you the care you need. Remember, preventive care is much cheaper than waiting to get sick and paying for getting care when you're sick. And for the students in the room, if you have insurance through your university, many of your insurances cover preventive care. So go to your school health centers or where your insurance is accepted and seek out care there. For everyone with insurance, always remember to be in your network to avoid additional cost. Also, for anyone that does not have insurance or have a family or friend that do not have insurance, but may qualify for marketplace insurance, open enrollment is now through December 15. Please apply or encourage them to apply before the deadline. While preventive care and primary care is essential for your health, maintaining your health starts with you. A healthy, balanced diet is important for boosting immune system and fighting diseases. Exercise regularly. Take at least 30 minutes a day for some exercise and some physical activities. Especially with COVID-19, exercise has become more essential as we are participating in less activities on a day-to-day basis. Keep a healthy body weight. Overweight and obesity increases the risk of many health problems, including heart disease and diabetes. It is essential for your health that you are maintaining it. Avoid too much alcohol consumption. Do not smoke. If you are smoking, quit smoking. And take care of your mental health. Your mental and your emotional health is as important as your physical health. Currently, our mental health is being impacted in many different forms. Some examples include our stress level in 2020 has probably been at its maximum for most of us. COVID-19, staying indoor, unable to meet family, friends, or colleagues, working from home, taking care of children or adults, having to balance work and family life, news media flooded with all kinds of politics that make us feel hopeless, the protests, the civil unrest, and the unjust we witness on a day-to-day basis, losing loved ones without the ability to say goodbye, losing job or worrying about losing job. These all can be disheartening and mentally and emotionally draining. To address your stress, anxiety, or mental health, first, as discussed earlier, maintain your physical health. And in addition to that, take breaks from social media and news. The more we expose ourselves to the news and the social media, the more stressful it can get for us. Make time to unwind. If there is an activity that you enjoy, do that activity to unwind. Connect with others via phone, video calls, or meet up in person in a social distance setting. Every state has some form of state-level mental health support, especially with COVID-19. Look up your state's support system and connect with it. And finally, call your healthcare provider for support. They also have telehealth service option, and you can get access to your mental health care from your home. Finally, I cannot live today without talking a little bit about our current pandemic, COVID-19. As we may have been noticing, the numbers are going up, and some states are adding restrictions for you, your family, and community safety. Staying healthy is a privilege not everyone can afford. So if you can afford this privilege of working from home, practicing social distancing, masking up, taking classes from home, please do it for yourself, your loved ones, and all the essential workers out there. Please continue to take precautions, especially during the holiday times as you're planning your travels and meeting with your families. Cover your mouth and nose when you're around others. People can be asymptomatic and still spread the disease. Avoid close contact with people that may be sick. Remember, people can be asymptomatic and still spread the disease. Wash your hand often. Also, avoid touching your face without washing your hands. Finally, get the flu vaccine. The flu vaccine will not protect you from COVID-19. However, it can protect you from the flu, which can save healthcare resources for patients affected by COVID-19. And it can also keep your immune system healthy from the flu. So in case you were to get COVID-19, you have a fighting chance. Thank you for joining this session, and I'm looking forward to having a wonderful discussion with you all. Thank you.